you guys have gone over how to catheterize in 266, okay? So you're going to follow that protocol, right again through, it's written out there.
And all your practices, I'll walk you through them.
So when you do your practice, Megan will walk you right through what you're doing and how to find da-da-da-da, okay?
Is the patient already pre-medded?
Yes.
And with the and then you put the catheter in?
Yes.
Okay.
So you've pre-medded, come over here, we put our catheter in, and then at that point we hook up to our line and we're ready to induce, okay? Typically the person who's going to be the monitor should do the intubation. We prefer that because then as the anesthetist you know the tube is in because you put it in, okay? So we give them the induction drugs to effect, intubate them, hook them up to the machine, and then you'll be in a group, okay? So the monitor's first job is to take a reading, okay? And then the helpers in the group can hook up the SpO2, put the lube in the eye, get a first temp, trim some nails, and then once the monitor says, okay, first reading's good, here we are, what do you think we should do, Megan or Kristen or Dr. Katie? Do you like where we are? Should we go up? Should we go down? You know. Then, after we've adjusted and the patient is doing well, we're going to clip and scrub. Okay.
Here, right?
Initial prep.
Initial prep, okay.
So we'll clip and then we do a target scrub pattern. Okay, alternating scrub and alcohol. We'll go over clip areas as we do the surgeries. Okay. But you want to have at least 2 clipper blade widths from the incision site, except for catheters. So what you need to do, you get your scrub, you go over the incision area 10 times, back and forth, and not like...
Don't start the incision for Dr.
Yeah,
Harbach.
please don't start my incision for me, okay? So you go 10 times back and forth, and then you target out, never touching the area that you previously touched. Okay?
It's just like you did learn for the catheters, just a bigger area.
And then you toss, and then you wipe with the alcohol. We're not scrubbing with alcohol. Okay? Okay? 3 times alternating. You may touch the hair here, and we kind of like you to, so it flattens out. All right. Once the patient is scrubbed, they are ready to go to the surgery room if the anesthetist says it's okay. So sometimes the anesthetist has 30 seconds till the next reading. So at that point, they're going to say, wait a minute, let me take the next reading, and then when they've done the reading, then you'll move.
One thing I want to add real quick is it's very common that you guys are prepping and getting ready as that room is being cleaned. The people who are cleaning it will usually hook up the machine and get the machine ready for you and everything. However, if you are in charge of this patient as the anesthetist, you are also responsible for making sure that your machine is hooked up properly. So have somebody watch your patient, go in there, make sure the machine is hooked up properly and everything's ready to go, and then say, okay, we're ready to move. If it's not, right, if it is not hooked up properly, it's on you. Okay, you are responsible for the care of your patient from start to finish. Okay, that is the only time, like Megan said, that you are allowed to leave your patient. But tell somebody you are walking in to check your machine real quick. Okay?
So pretty much as the monitor, as soon as they're induced and hooked up, your stethoscope goes on the patient, and your stethoscope does not leave the patient.
Right.
You need to politely dictate, can I have a temperature, can I have this, you know, hey, the heart rate's dropping, you know, just whatever. So first thing
Can you
is
stop shaking? I can't
stethoscope.
hear the heart rate.
Yes.
And how should we carry the patient in if we're already sterile?
You're not sterile.
No, the patient is sterile.
Basically.
Right here.
They're not sterile, they're just clean.
Well,
We're
yeah.
going to do the
Yeah.
sterile
Oh,
scrub
okay.
in there.
All right, so this is just pre-scrub.
Right.
Okay. Okay.
We do too. Okay. Okay. When you're doing these things, okay, you don't put on top of that because then the nasty bottom is on the very clean top that's going to go back over our gauze that we're supposed to be cleaning with. Okay? Want to do that.